It's 6:30 here in India, but of course it's early in the morning on a Saturday in Boston, and we welcome very, very warmly Dr. Peter Wayne, who is a very important researcher and of integrative medicine, as well as a practitioner and teacher of Tai Chi and Qigong, and he's going to be speaking to us today about how integrative medicine and preventive health are important, especially when it comes to areas like falls and cognitive decline. Welcome, Peter. I first met...
Good evening. Thank you.
Thank you. I first met Dr. Wayne exactly 10 years ago, give or take a few months, when I went to Harvard to meet his team at the Osher Center of Integrative Medicine, and had the privilege of speaking to them about the work that we were doing, which was very nascent at that time. So in the order of proceedings, I'm going to start by telling people a little bit about what Buddhi Clinic does. My name is Dr. Krishnamurthy. I'm the founder of Buddhi Clinic, for those of you who are coming to this program for the first time. And we then will have, I will introduce Professor Wayne, and then we will have his lecture, and then we have Q&A. Please keep your questions coming into the Q&A box. We will try and address all of them as we go through the program. Can I request Shobha to share screen? Next slide, please. So the Buddhi Clinic promise is really to go beyond medication and to integrate modern science and ancient wisdom, to provide everyone who approaches us the opportunity of professional care and rehabilitation, which we try and deliver with integrity, sincerity, and quality. The aim is to deliver care that improves activities of daily living and quality of life, and that addresses body, mind, and soul. And clearly, the most important part of all this is to optimize each person's human potential. Next slide, please. Our patients straddle the entire human lifespan. Our youngest patients are small children in whom a neurodevelopmental disability is suspected. Our oldest patients are between 90 and 100 years old with problems of neurodegeneration. And of course, we have people right through in between. The next slide, please. I wanted to just talk a little bit about why integrative health and why integrative health for neuropsychiatry. Health, as we know, is a state of complete physical, mental, and social well-being, not just the absence of disease or infirmity. And this is what the WHO said many, many years ago. And of course, mental health is a state of well-being in which every individual realizes his or her own potential, can cope with the normal stresses of life, can work productively and fruitfully, and can make contributions to her or his community. And ancient wisdom incorporates spiritual to health. And of course, there is of course a growing understanding that spiritual well-being is as important as physical and mental well-being in a number of situations. The next slide, please. In Ayurveda, there is the term Prakriti. Ayurveda is the ancient system of health in India, which is centuries old, which emphasizes the importance of knowing each person's constitution, to know what type of food and drink and what type of exercises are important for maintaining their health. And of course, this brings us to today's webinar. It's important to know what we can do in terms of activity to maintain our health. And of course, to understand each person's constitution, because then Ayurveda believes herbs, diet, and other regimens, including yogic postures, can be advised for the person. Next slide, please. It has been described as the extraordinary mind-body medicine of India with its great yogic spiritual tradition. And it's a tremendous resource for bringing wholeness to all levels of existence. It's the world's oldest and one of the most complete systems of natural healing, containing great wisdom for all humanity. And of course, this is how we think about Ayurveda in India. But those people like Dr. Wayne, who have studied traditional Chinese medicine, will say that that is old too, and that has wisdom too, and that also dates back several centuries. Next slide, please. And of course, there are a number of psycho-spiritual practices that are inbred in classical Ayurveda, and many of these are yogic practices. The next slide, please. Interestingly, yoga is one branch of medicine, ancient medicine, that is well studied today in terms of neuroscience, using functional MRI and so on. And there's published research that shows that yoga brings about changes to brain metabolism and various other body metabolisms. And I think this is something that we all need to keep in focus, because we're also going to now listen to an Eastern practice today that has much to do with bringing about change. Next slide, please. We say that we offer comprehensive care. And so I always like to ask, why do we offer comprehensive care? Our focus is the brain and mind. And a number of disorders that we deal with are debilitating, with either static or progressive disability. And while medical and surgical interventions are available, very often they are limited in their scope and prospect in many of our patients. So if we think of people with autism spectrum disorder or head injury or Parkinson's disease or dementia, what options do we have apart from pharmacotherapy or maybe sometimes surgery in our armamentarium? And of course, it makes eminent sense to think about what other systems can offer us in these situations and how that can be integrated into medical practice. The next slide, please. And therefore, at Buddhi Clinic, we say we try to bring together under one roof modern medical treatment and rehabilitation techniques with the richness of ancient and diverse medical traditions. And we harmonize these many approaches so that they serve complementary rather than antagonistic purposes. And we have developed protocols and procedures that make these sustainable, replicable, and measurable. Today, it takes Buddhi Clinic 6 weeks to set up a new center. And I think that is in itself a testament to how process-driven the work has become. The next slide, please. In general, complementary and alternative medicine is described as a group of diverse medical and healthcare systems, practices, and products that are not considered part of conventional medicine. The director of NIMHANS, Professor Gangadhar, the former director, once asked a question. These systems are often much older than modern medicine. Why are they called complementary and alternative? And that is a question that's not probably asked often enough. It's an important question to ask ourselves. The next slide, please. And people reach out because they are dissatisfied with the outcomes of conventional medicine, because they have refractory disorders that require long-term care. And very often people are just tired of taking a lot of medication or having a number of procedures, because they would like to receive holistic care. And of course, because many people explore these things on their own. Next slide, please. And this is a study from the US that showed a very large number of people attending a Veterans Affairs hospital for neuropsychiatric conditions were actually reaching out for complementary and alternative medicine solutions, very often out of pocket. The next slide, please. So good integrative medicine is what we try to say at Buddhi Clinic is important. Multiple interventions to address various dimensions of a disorder, everything available under one umbrella, a combination of therapies enhancing relief and providing continued benefits, focus on quality of life and activities of daily living, both of which are important to all of us, better coping mechanisms for pain, disability, and mental health, an emphasis on holistic wellness, and of course, being able to address the lifespan, child, adult, and elder. Everyone deserves good health care. The next slide, please. So we have a full house of Ayurveda, we have yoga therapy, we have naturopathy, including water, mud, and herbal preparations. We have acupressure, acupuncture, and reflexology. We have physical and occupational therapy. We, of course, prescribe medication to people. We have a full and expanding house of neuromodulation, RTMS, TDCS, TAVNS, soon to have FMS. So many, many modulation techniques that can help people. And of course, we have psychological therapy delivered by psychologists. The next slide, please. And of course, a whole team of people working in an interdisciplinary fashion is extremely important in integrative medicine because they need to talk to each other about the patient they're working with. So truly interdisciplinary work is extremely important. The next slide, please. And of course, we cover a very large range of disorders across the lifespan. The next slide, please. We actually take a lot of treatments home, and we have many elderly and disabled people who need work to come home. And this we see as something that's really important. The next slide, please. And one big achievement during the pandemic is that we managed to take all our work online. And we have now patients who have actually never visited our clinic, but they receive do-it-yourself care as well as video call supported care wherever they are. And we see this as a huge step forward. The next slide, please. For hospitals and for elders, we now have a unique approach, a 3M approach, which focuses on mobility, memory, and mind care, mental health. And this we see as also being extremely important to target specific populations and specific locations. And the next slide. We are very proud of our Seva program, which works with people who are less fortunate. We have been able to address over 100 individuals every year in the last 3 years through this program, which gives people an additional set of treatments free without them having to pay for it. And we're very grateful to the very large number of people who support this program, donors, corporates, individual philanthropists, and others. The next slide, please. This is our final slide, just to say that we have some very interesting data to show that when we integrate treatment, this comes from Vivek, who's in the audience in the Bodhi Clinic room. The TDCS, which is the brain stimulation procedure in people with mild cognitive impairment, which is a form of early brain aging, which can lead to dementia. And when that's integrated with Ayurveda, physiotherapy, yoga, naturopathy, and psychotherapy, 73% of patients receiving these treatments in various permutations and combinations showed improvement in their mini mental state examination score. And a very large number of patients also showed significant improvement in specific behaviors in the neuropsychiatric inventory. And so we are able to now show that working with people with combinations of treatments can make a very big difference. And I think this is a model of integrative medicine. I don't believe it's the only model of integrative medicine. There are several wonderful models around the world. But we believe that this model has potential to scale itself up to a number of locations. Next slide, please. So with all that, so I'm very happy to have had the opportunity to introduce everyone to Bodhi Clinic. I now introduce our speaker for the day, Dr. Peter Wayne. He is a researcher, practitioner, and instructor of Mindbody and Integrative Therapies. He is the Bernard Osher Associate Professor of Medicine in the field of Complementary and Integrative Medical Therapies, Harvard Medical School, and Director of the Osher Center for Integrative Medicine, jointly based in Harvard Medical School and Brigham and Women's Hospital. When I met you 10 years ago, I believe you were the assistant director, Peter. So I'm so happy to see that you have now taken charge. A brief about his career. He started his education with human ecology, biology, a master's and a biology PhD, both from Harvard. He went on to do postdoctoral training in the United States Department of Agricultural Global Change, and he was a postdoctoral fellow in ecological genetics and climate change. So everything to do with evolutionary biology in Harvard University, Cambridge, Massachusetts. And Subsequently, he has been affiliated with a number of organizations, the New England School of Acupuncture, the Beth Israel Deaconess Medical Center, Brigham and Women's Hospital. He has been with the College of the Atlantic. He's had a stint in the UK, Cambridge, Bangor, and also Dublin, Ireland. He's the founder of the Tree of Life Tai Chi Center in Somerville, and he continues to teach and practice there. Lovely to hear that. He has had a number of awards, too many to actually speak about in a short period of time. But this includes the Will Soliman Award of Excellence in Medical Communication. And he has a number of grants and a number of advisory positions, and he's very active in research. The primary focus of Dr. Wayne's research is evaluating how complementary and integrative therapies clinically impact aging and chronic health conditions, and understanding the physiological and psychological mechanisms underlying observed therapeutic effects. He has served as a principal or co-investigator in more than 30 NIH-funded studies and has authored nearly 200 peer-reviewed articles. He has 40 years of training experience in Tai Chi and Qigong and is an internationally recognized teacher of these practices. He has authored the Harvard Medical School Guide to Tai Chi, which received the Award of Excellence in Medical Communication by the American Medical Writers Association. So it's an honor and a pleasure, Dr. Peter Wayne, to have you join us today, and we do look forward to your lecture. Welcome, and thank you for taking the time.
Thank you, Dr. Krishnamurti, for such a kind and generous introduction. And thanks to all the members of your team for making this presentation internationally possible. And before I start, I just want to congratulate you on all your successes. As you said, we met 10 years ago, and many of the ideas you shared at that time were just ideas and seeds. And it's incredible to see how far you've come and the impact you're making and the evolution of this East-West healthcare system that truly is integrated and very much needed. I'm going to try to share my screen first. I'm assuming that this will work. Yeah?
Yes, we can see.
Super. So what I'd like to share today are some ideas related to an integrative view of health that I think will resonate very fully with what we've heard from Dr. Krishnamurti already. And talk about how parallels to what is happening now in India with Ayurveda are happening around the world, drawing a little bit more on East Asian and Tai Chi practices of Tai Chi and Qigong. But I think you'll see lots of parallels, and hopefully we hope it's going to save some time at the end for discussion. And I think some questions about where there are similarities and differences between these systems might be good questions to explore. Before beginning, I just need to disclose, as Dr. Krishnamurti said, that in addition to being a researcher, I oversee a community-based program of Tai Chi in the Boston area, but there's a strong firewall between these personal interests and my professional activities at the university. So I'm going to begin talking today about the opportunities and the limitations in what we call reductionist thinking, or the opposite of maybe integrative thinking in medicine, and why integrative medicine and health is so important. And I think, as I said before, this will echo very much what we've already heard so far. And then I'm going to use the core of my talk to illustrate these examples, drawing on Tai Chi and Qigong. I'll introduce those as tools for prevention and rehabilitation in the aging process, focusing more on middle to later stages of life, where much of the research has been focused in Tai Chi and Qigong. And I'll focus a lot on prevention of falls. And I'll be weaving throughout these ideas of mind and body, as we've already heard, how interdependent they are. And not only the mechanics of falls and the epidemiology and how Tai Chi is helping, but how changing mindset, in one case, fear of falling, can interact with mobility and the actual risk of falling. The mind and body are very interconnected. I'll talk about how exercise and Tai Chi can improve cognitive function and perhaps delay decline in older adults. And going back to this ecological model of mind and body, how what we think affects how we move, and how we move affects how we think, both in terms of cognition and falling, but also in the context of pain. And a lot of pain has very rich psychophysiological dimensions, which opens the door to the great value of these multimodal mind-body therapies. And as I said, I hope we have lots of time for discussion and addressing some of your audience's interests and concerns. So I think, as most people here already know, beginning around the 17th century, but especially in the past 150 years or so, Western medicine has been greatly influenced by reductionism. That is a way of seeing the world that believes that complex phenomena, including health, can be best explained by analyzing increasingly simpler components, basic building blocks, or mechanistic processes associated with a system. Reductionism has supported the evolution of medical specialization and organ-based medicine, which of course, for any of us who become seriously ill, are in need of a cardiologist or a neurologist or an oncologist, we're grateful that these professions focus the majority of their attention on knowing everything there is to know within that organ system and how it impacts others. In more recent years, reductionism has drilled even deeper and led to great insights into subcellular, genetic, and molecular levels, leading to remarkable breakthroughs in precision therapies for cancer, cystic fibrosis, and many other conditions. However, my guess is that most people listening today also appreciate that there are costs or side effects to reductionism or specialization in medicine, namely the fragmentation of individuals and the way they're cared for into disconnected parts and processes, with less appreciation for the whole person. To use an ecological metaphor and leaning back into my old research area in ecology, reductionist medicine sometimes does not see the forest for the trees. So at our Osher Center, and my sense is the same as at the Buddhi clinic programs, integrative medicine is about treating the whole person and enhancing the interconnections between the systems. Yes, I think it's important to have multimodal components that live alongside each other. So here in the West, we have acupuncturists that are embedded in pain clinics and mind-body practitioners that are embedded in stress clinics. But it's more than just the co-location of these. It's about thinking about the body in a much more ecological way. And I think this is the same in East Asian Tai Chi, Qigong, traditional Chinese medicine as it is in Ayurveda, although I'm not an expert in Ayurveda. And I think that that's nicely captured in this cartoon here. And on the right, this comes from a textbook of Chinese medicine. The body is depicted as an ecosystem. And the goal of ourselves and caring for ourselves and the healer is to make sure that all the components in the ecosystem are in balance, that they feed each other, and that health emerges out of this balanced complexity. And all these pieces are highly interdependent. On the left, you see, and of course, this is an extreme polemic, a diagram of the body as an autonomous set of parts, like a machine, and those parts are replaceable, and they're somewhat independent. And so what we're thinking about in integrative medicine is much more what happens on the right, and how traditional practices have been set up to appreciate this ecological view, and therefore treat the system as a whole in a more organic way. And I think there's a lot of wisdom in that, as Dr. Krishnamurti has already pointed to. And again, I won't say much about this here, we can come back to this later, but I'll be focusing on Chinese medicine in particular, but I think the same ecological systems view of health is integral to many traditional systems, including Ayurveda. So just to make sure we're all appreciating the sort of content of the research I'll be sharing and some of the clinical practices, I thought I'd begin with a definition of Tai Chi and Qigong. They're both mind-body exercises that are rooted in a number of Asian traditions, including the martial arts, traditional medicine, and philosophy. The training integrates slow, intentional movement with breathing and a number of cognitive skills, and these will be important to lean on later, including heightened mental focus, body awareness, imagery, visualization, and together they aim to strengthen, relax, and integrate what we call the body and the mind and the spirit, and through that improve health, personal development, and Tai Chi at its roots is a martial arts. So there's also some potential for self-defense and I think more broadly resilience. This cartoon, I think, captures a lot of what I want to say today. And I think you can picture a Tai Chi practitioner in the middle here, but I think you can put a yoga practitioner or a meditation practitioner equally in the center. And what it says is that these interventions are inherently multimodal, that they're like a multi-drug intervention. And at the top, these are some of the active ingredients, so to speak. You have an aerobic component to this exercise, similar to yoga, musculoskeletal piece. So in many ways, it acts like a traditional exercise or conventional exercise. But we're interested not just in the pieces to develop our biceps or our hamstrings, but like in yoga, we're interested in how all the pieces fit together, the biomechanics, the dynamic coordination of these pieces, which I think is more than the sum of the parts. There's language here that's limited, but we focus a lot on what we call relaxation or feeling at ease in the mind and the body. That happens through things like mindful attention. And most of these things have been studied quite a bit, even out of the context of Tai Chi or Qigong or yoga. There are studies on mindfulness, on relaxation techniques. Here we talk about visualization or imagery, but there's a great deal of research on placebo and what we think greatly affects on a very profound and objective physiological level what happens. So this has been built into these traditional ways of teaching healing therapies, what you believe. And in the context of Tai Chi, for example, people with balance issues will say, feel a little more like a tree with deep roots in the ground and move like water. And just those suggestions change the way people carry themselves. And we're studying this objectively in the laboratory. But what you believe, the thought structures you have, greatly affect the physiology and the biomechanics of how you move. But this is known to these wisdom traditions. In the West, we try to get rid of this to what is the single active ingredient, that reductionism. And I think we lose a lot in that view. Breathing, of course, is a key element of all these practices. Many of these things happen in a social kind of setting, and we know that lack of social connection is such a huge source of morbidity. And the philosophy in this, in the West, more is better, give it 120% effort. And in the East, maybe, a little less is more, back off, don't try too hard, go with the flow. And so you see that you have this very rich set of ingredients that can be applied to various health conditions. In this slide here, I just focus on falling and just to illustrate this ecological framework. On the right are a series of risk factors that we know contribute to falls in older adults. Each one of these has been studied thoroughly in Tai Chi in strong randomized controlled trials. I won't be saying things about all of them, but we know that having weaker lower extremities is a risk of falling, sarcopenia as you age, and Tai Chi strengthens lower extremities very clearly from lots of studies. Sensory deficits that happen with aging or peripheral neuropathy due to diabetes or other neurological conditions, cancer treatments, loss of sensation in the soles of the feet can contribute to risks of falls. Tai Chi has been shown in normal aging, but also in diabetes, for example, to change the sensitivity, plantar sensation, and that improves balance and risk of falls. Coordination, there are lots of studies of people on a treadmill where there's an experimental perturbation, they're safe, they're wearing a harness. They not only recover quickly, but they recover more intelligently. The sequence of firing of muscles changes in a way that makes them more safe. I'll be saying more about the cognitive and affective pieces, but as I said before, what we think about or don't think about and our emotions feedback on falls, especially anxiety. And even pain, and I'll say some things about pain later, but pain is an independent predictor of falls. It changes function, mobility, but also it's a distractor. And Tai Chi can help with a lot of musculoskeletal things. The key point here is that unlike a drug, like an SSRI or aspirin or something, that targets a specific molecule and then affects change from that one point out, this is like a multi-drug intervention that penetrates the body in an ecological fashion, hitting multiple systems and sort of shifting the way that the system moves forward from lots of different contact points. And so I think this can apply equally to some of the goals that are happening in the Buddhi clinic with multimodal therapies for complex conditions that involve multiple systems. So I'm going to focus on balance and cognition for a while for a couple of reasons. They're nice examples of the application of these tools, but they're also huge public health issues for our aging societies. Many of you here know that about 1/3 of adults over the age of 65 fall each year. This results in great morbidity. 1 out of 5 of these adults who have a fracture will die, not because of the trauma itself, but because of the sequelae. And fatalities related to falls exceed opioid deaths in the West by a factor of 4. Not surprising, these have huge public health implications. And in 2020, $55 billion, it's estimated, were associated with caring for people who've had falls. And this number and this epidemic is going to worsen with our aging society in the West. And there's no pill you can take to prevent a fall. The epidemic and the sort of epidemiology of cognitive impairment is even more alarming and striking. About in the West, in the US, and you know the statistics in India as well, 65% of the people, 10 million people over the age of 65 have mild cognitive impairment. Large number of additional people have full-blown dementia, including Alzheimer's. And the cost for caring for these people is skyrocketing, billions and billions of dollars. And again, you know, despite great efforts to find pharmacological solutions, there are no real promising tools out there on the horizon. So there's a need for alternative ways of approaching this. And the approach to both of these seemingly separate issues for our aging society has not been very integrated. If people have some balance issues, they may be sent to do more functional, physical training, strength training, flexibility, agility, maybe a little stamina, work with aerobics. If they have mental issues, mental problems, cognitive issues, maybe do some cognitive training, learn a language, do some puzzles, some social activities. And again, there's no promise for pharmacotherapy. But what we're learning is that even things as simple as walking require very complex interactions between top-down processes, or what we call more mental processes, and bottom-up physical processes. Very integrated systems. And this is well described in the literature about the interactions. The take-home message, as I said, is how you move affects how you think, and how you think affects how you move. And so we want to reframe these sort of reductionist views of sending people to different therapists for these problems and approach it in a more holistic way. And we think that these mind-body practices are a good tool. As an example, Dr. Krishnamurti showed some transcranial direct current stimulation, maybe targeting the prefrontal cortex. But we know that this area of cognitive function we call executive function. It's like the executive at a company. Hey, you do this first and then do that, or let's plan, let's set some goal setting. This higher level meta cognition we call executive function is very important. And there's good studies now, and this is a meta-analysis of 27 very large studies that show that people who have even modest deficits in what we call executive function, multitasking, planning, etc., with the rest of their cognition intact, have a 44% increased risk of falls, independent of everything else, you know, their physical strength, their smoking, their diet, etc. So what you think, how you think affects how your risk of falls and how you move. The converse is also true. How you move affects your risk of cognitive decline. I'm going to walk you through this graph, but I think it's really relevant to the work that you guys are doing, and I think it illustrates this mind-body connection really clearly. This is a large epidemiological study. This is dated, so there's much more data on this. But there's a simple question that clinicians can ask their patients, and it's called the Motor Cognitive Risk Instrument. And it's a good predictor of future dementia. Basically, when you go into a provider's office, they ask two very simple questions. Do you have any complaints about your memory? You know, where you put your keys, nouns, words, things like that. Yes or no? Very simple. And then they ask you to walk, and they look at your walking speed relative to people your age, whether you're normative in your gait speed, 8-meter walk. And you're either slow or you're normal or above normal. This is what's called a survivorship curve of nearly 27,000 people. I think their average age here is 70 and above. Oops, excuse me. And at baseline, none of them had any signs of dementia, so they're all dementia-free. What you can see in this top line with people who had no cognitive complaints or no deficits in gait is the epidemic I'm talking about, which is in 12 years, about, what is it, like 25% of these people develop dementia, right? So that's scary. But what I want to use this graph for is to illustrate another point. This point here, this green line, suggests that if they had cognitive complaints at baseline, but no dementia, their risk of developing dementia 12 years later was higher. And in this case, it's about, I think it's a 10% difference. Okay. But what to me is really interesting is people who had no cognitive complaints but simply walked slower had a much clearer risk and a much greater risk of developing dementia than people who had cognitive complaints. And then, of course, people who had both cognitive complaints and slow gait had the highest risk of developing dementia. So how you walk, how you move, is a better predictor of cognitive decline in this case than what you're thinking 12 years back. Really important, really striking. And so this appreciation of this integrative nature of mind and body, or the interdependence of cognitive and motor function, is making us rethink how we train people, much like it's happening in your clinic. Maybe we need to have people do physical exercise and mental exercises, do Sudoku puzzles while they're on a treadmill. And in fact, that's happening. There are dual task trainings that are happening in aging, and you can see on the left here, this older man is doing some strength and balance training while he's being challenged with some cognitive tasks. Younger generations may remember gamification, Dance Dance Revolution, and other things where you have to move following very complex and increasingly complex cognitive patterns. And then there's some really modern techniques that are coming out in terms of virtual reality, where you can walk through space or be exposed to things and you're challenging your balance at the same time, or your gait. So lots of different approaches that are penetrating conventional care. But what I want to focus on is this old school approach to integrated mind-body training, and how implicit in this training there's an appreciation of the interdependence of mind and body. And I'll start with some general information on what we've learned from fall prevention, some work on cognitive decline. I'll spend a good amount of time looking at how we study the interdependence of these to actually see that it's the toggling back and forth that of mind and body processes that contribute to both. And then I'll say some things later about pain. Okay, so I tend to be conservative in conclusions. Tai Chi is literally one of the best tools out there for preventing falls in older adults that are community-based ambulatory adults. The Cochrane review, which is a little dated now, suggests that there's about a 20% reduction in falls for people who study Tai Chi for 6 or so months. And this is in very healthy community-based adults. When we start to include higher risk fallers, including Parkinsons, stroke survivors, or just people with other levels of frailty, we start to see some effects that are closer to 30% reduction and higher. And I'll give you an example. I do want to say, though, that this is more limited to community-based adults. And surprisingly, this work within assisted living facilities or hospitals, for example, has not been replicated. That we don't see, we see some benefits, but not at this magnitude. But there's good evidence from large-scale trials. And here's one of them. This is some work done by Dr. Fuzhong Li out in Oregon. He's been well funded by the NIH, and he's done a lot of really interesting work. And his more recent work, which you should keep an eye out for, is more focused on cognitive decline. But this is published in a very high quality journal, and it's a 3-arm randomized trial where over 200 people are randomly assigned to 6 months of Tai Chi or to a multimodal exercise, which includes strength training, resistance training, aerobics, etc., and then to a seated stretching exercise. In some sense, that's the real control group, because there's very little balance training. They had 6 months of training, and they also had 6 months follow-up, and their results were quite striking. After 6 months of training, when they compared the Tai Chi training to the seated stretching, there was nearly a 60% reduction in falls. When they compared the multimodal, the Tai Chi to the multimodal, even having people engage in multimodal exercise, there was still a 31% benefit of Tai Chi in terms of reducing risks of falls compared to the other exercise group. What was really striking was when they followed up on this population 6 months after training commenced, many of them continued, some of them didn't. There was a 75% reduction in injurious falls. And this is where the rubber hits the road in terms of taxing our public health system and having significant morbidity in the individuals that suffer a fall. So this is a good tool, and it's persistent. What was interesting is you can take this Tai Chi program that's been studied under a very careful lens in a randomized controlled trial, and you can say, will this work in community-based centers? And I imagine this would be, these are senior centers, but I imagine this would be a parallel with the Buddhi clinics, just bringing it out into less academic, but practical community-based centers that deliver care. And what he did with his group is he brought the program that was proven effective in a trial to 35 centers in Oregon. He replicated the program. In this case, it was 48 weeks of training, not just 6 months. There was good adaptation. They want to know, is this implementable? You might have something that works with all the money that's involved in doing a clinical trial and people calling their participants every day to remind them of the practice. But does it happen in the real world? And he did. There was adaptation, and basically they replicated the same result. There was about a 50% reduction in falls. So this is important. It's called implementation research, and it means that it can go outside the laboratory and have real world effects. And so he's done some great work in this. What I want to just say here is one of the mechanisms, there are many mechanisms that we think, if you remember that wheel that I showed you, all the different ways that Tai Chi can impact falls. One of them is this real vicious cycle between mind and body. And any of you who've known an older adult or who's had a fall, they carry themselves often in a very guarded way. That fall creates an emotional trauma and anxiety, and it's technically called fear of falling. And people hold themselves, as you can see this woman coming down the stairs in a very guarded way. They hold their breath, their musculoskeletal system is tensed. Often they're distracted because they're worried about falling and they can't notice what's going on in their environment. And it's a vicious cycle. You develop this fear of falling. That fear of falling results in more limited social activities. That reduces your physical function and your confidence. And that increases your risk of your fear of falling, which then makes it more likely you're going to fall. And it's hard to break. And Tai Chi, through penetrating not just the physicality, but teaching people to notice how they're not breathing, how they're tightening their upper body while they're doing tasks, to bring their mind and body together, to give them imagery like feel like you're a tree with roots in the ground. That combination seems to affect both the mind and the body and reduce the fear of falling. There's some good meta-analyses out there from many different randomized trials showing that this construct, and you can measure fear of falling very well with an instrument, much like a depression instrument, is reduced by about 40%. And it's also in larger studies is a clear mediator. So changes in fear of falling predict are associated with actual reductions in falls. I would say that more generally, what we're learning is that this ease, and this shows up in pain as well, people who are afraid of moving, which we call kinesiophobia because of fear of triggering a pain situation, that often that's psychological, that the wound is already healed, but there's a residual psychological construct that's slowing things down and noticing the body, becoming more interoceptively aware, proprioceptive, relaxing, breathing while you're moving, changes overall self-efficacy. And we're seeing that people who do this that have been deconditioned for a while feel more confident to engage in other forms of exercise and activity. So we're seeing Tai Chi and things like yoga as well and other things as sort of like a gateway exercise. They're ways for people to feel more safe and comfortable in their body and then to engage in other activities, including the Tai Chi and yoga. The literature on Tai Chi for cognitive function is not as robust in terms of the evidential support for benefit, but there's definitely some good promising work. This is a bit dated. It's a review we did, 11 randomized trials. There's some new references here. Basically, there's some good evidence that it can improve many domains of cognitive function, including supporting people who already have been diagnosed with mild cognitive impairment. One of the areas that we were particularly interested in is improvements in executive function. As we said, that's important for balance, but also early declines in executive function are predictors of future dementia as well. So if we can retard the rate of progression of decline in executive function early on, we may be able to change the trajectory of cognitive decline in general. This is an example of a study that was, it's a little dated, but it's a good example of the sort of level of studies that are out there. This is a randomized trial of 120 people. They were all cognitively intact. They had a mini mental score greater than 25. They were independently living in the community, about 68 years old. They were randomly assigned to 4 groups: Tai Chi, aerobic walking, social interactions, and a no intervention control. Again, it's a nice study because it's very hard to do long-term studies. It's very easy to give people pills and send them home, but to engage people in activity for a sustained period of times and to really ask for behavior change is much harder. So this was done for 40 weeks, 3 times a week. So there's a good quote unquote dose of the intervention. And this is what they found over 40 weeks. This first panel on the bottom left is a composite dementia index, and a higher score means that there's less dementia. You can see how much Tai Chi improved compared to the other interventions. Executive function, this is done with the trail making test. And the faster you complete this task, the better your executive function. You can see that Tai Chi reduced the timing of that in a significant way that was both significant clinically as well as statistically. And this study, one of the reasons I showed it is that it's one of the earlier studies looking at actual imaging of the brain and the total volume of the brain. And surprisingly, just 40 weeks of Tai Chi training increased brain volume compared to walking and other and no intervention at all. There's some positive benefits of socialization as well. There's a slowly growing objective database of what happens in the central nervous system and in the nervous system as a whole in response to Tai Chi. The literature on meditation is much greater. The literature on acupuncture and neuroimaging is much greater. But there is a growing literature. And what it shows is that structural parts of the brain change, as we saw with quote volume, but places like the hippocampus, the volume of that changes. The networking between these regions, the neural networking and connectivity between important areas related to cognition changes, and markers like brain-derived neurotropic factors that Dr. Krishnamurti showed earlier also change. but it's an emerging evidence base, but I think it's really promising, and it supports what we're seeing, that this warrants further investigation and that it's safe and effective. This was just a small study that I threw in just because it's so timely with all the stress that's happening during COVID. This is, I think, happened in Eastern Europe, but it was a small study, and just in 12 weeks, they had objective measures of changes in brain-derived neurotropic factors in the Tai Chi group compared to a weightless control group. So change can happen, and we can measure it not just with clinical measures of cognition, but also with objective measures of important transmitters and neurological markers of brain function. So I want to say a little bit more about this cognitive motor interference, because I think this going back and forth, what we call, mindful movement, is really important. And one of the ways we can do this is with studying an experimental task called a dual task. And many of the falls that happen out in the real world are when people are distracted. There are horrible examples every day you can read in the newspaper of someone looking at their cell phone while they're on a train track and they're distracted and they fall off, and tragic things happen, or they walk off a pier because they're not paying attention into some ice water. Of course, looking at your cell phone while you're driving, that there are costs to being distracted. And the question we want to know is, if you're learning a mind-body practice like Tai Chi, does it allow you to go back and forth, not necessarily to make you want to drive while you're on a cell phone, but to be out in the real world and not fall while you're engaged in conversation or an important task? Does Tai Chi training help you with that executive function piece? And does that translate into better mobility? This is an example of an older woman coming into our laboratory and walking. This is real time. You can see on the top, she's walking faster than on the bottom. On the top, she's being asked to walk while she's counting backwards by sevens. So she's got a mental distraction. And two things to notice. One, she's walking faster, and you'll see when she turns the corner here in the bottom panel, that not only is she walking faster, but the regularity of her steps is much more consistent than the top. And so there are two measures that we get from this. One is speed, which we know is important, predictor from what we saw before, but also the stride time variability. And the increased variability below is known to predict falls and many other issues. It's a marker of cognitive motor imbalance, and a good predictor of falls, as I said. So what we want to know is, if she learns Tai Chi while she's counting backwards, can she look more like this upper panel with some training? Even though she's being distracted, her gait will be healthier. And so this is a very objective way of measuring this mind-body connection. And the short answer is yes. This is a study by Brad Manor, one of our postdocs at the time, but now he's an associate professor at Harvard. And this is not in a group of spring chickens, so to speak. The average age in this study was 88. It was in some assisted living facilities here in Boston. And what you can see is that their walking speed during a dual task improved significantly after Tai Chi training, compared to an educational control group that met with a nurse and talked about health. So there was an active objective control group here. This is looking at variability in stride, and this is a different study. This is looking at a group of Tai Chi experts in the Boston area. We wanted to know what's the impact of long-term training. So this is like a cross-sectional study. These experts had about 25 years of Tai Chi experience. If we don't see a benefit of Tai Chi at that point, then it's hopeless. But what we see here is, compared to age-matched individuals between 50 and 80, who were very, very healthy in this case, but did not practice Tai Chi, the amount of variability in stride time was much lower in the Tai Chi group than the naive group, and lower variability is healthier. Right? We could take those people here in this naive group and randomly assign them to 6 months of Tai Chi, and they start to move in that direction. I'm not showing you that data. And we've also done this in people with Parkinson's disease. And as you know, automatic movement due to dopamine deficits and other neural problems make gait quite irregular. In fact, the extreme irregularity would be considered freezing of gait. right? And what we've seen here is that Tai Chi improves that stride time variability compared to a usual care control. Modest effect, small study, but this has been replicated in Tai Chi in good articles in the New England Journal of Medicine by Fuzhong Li's group has shown to reduce falls significantly. We've also been able to look a little more at the physiology of this. I won't say much here, but even the mental task of counting changes how coordinated the lower complementary muscles of the gastroc and the tibialis anterior walk. In healthy walking, they should sort of be out of phase. The back contracts, the front relaxes, and vice versa. But when people are distracted, it's more like a fear reaction and they co-contract. And Tai Chi training reduces that level of co-contraction, which may explain some of these higher level mobility issues. So I'm going to stop there and just shift a little bit to pain briefly, and then we'll have some time to talk about some of your questions. But pain is a huge issue in our society. In the West, you know, adults over 65, you know, more than a third or nearly a third of them have chronic pain, and huge impacts on their quality of life, their morbidity, and the costs of society. And we've seen some of the real negative impacts of just relying on pharmacological therapy in terms of opioid addiction and things like that. So there's really a need for things. And I just want to highlight a couple examples of the mind-body connection. What I was saying before about this top-down, bottom-up in the context of Tai Chi for pain. And I'll pick two studies, one on back pain and one on a cancer-related pain that my group did. The one on back pain is a dated one, but there's about a 30% reduction in lower back pain and back pain related disability for people who practice Tai Chi for 12 weeks. There's some good stuff on osteoarthritis of the knee. We've done some work on neck pain, and we see this consistent effect on reducing the level of pain, how much it bothers people, and the overall impact it has on quality of life. What I want to show here is that this study by Amanda Hall also measured cognitive or psychological constructs. And one of them is catastrophizing and ruminating, worrying about that pain. And what she found was Tai Chi reduced that mental piece. But what struck me about this study and why I want to share it is that you would think that Tai Chi is going to help pain by changing posture, strengthening muscles, creating flexibility, and it probably did do that. But in mediation analysis here, statistical parsing out of variance, what they found was that 2/3 of the improvement on back pain related disability had to do with this mental piece, catastrophizing, and 1/3 of it on the intensity of pain had to do with catastrophizing and rumination. So changes in the mind changed not only pain, but how people integrated or live with that pain in a daily life. So mind-body connections, really important here as well. And then I'll finish with this last example. This is a very small study, an uncontrolled pre-post study that we did in my group, and it's a horrible condition. These are with breast cancer survivors that have to go through the trauma of being diagnosed with cancer, then they endure the serious side effects of chemotherapy, radiation, and in this case, surgery. And all of them have gone through either a lumpectomy or mastectomy or bilateral mastectomy. So they've reconfigured their body and their self-image. And then if that's not enough, 40% of these women come out the other end with chronic pain. And that chronic pain holds them in that cancer story, and it makes them think, is this pain still the cancer, or why do it just keeps them in that place. And there's very little that we can offer them. But what we believe and what motivated the study is that pain, that trauma is multidimensional. It has a physical piece, it has an emotional piece, it has a cognitive piece, it has a social perception piece, and maybe this complex mind-body intervention we offered them in a group setting could move the dial. And so we taught them Qigong in a circle. They all stood together, all these cancer survivors, for 12 weeks. And we measured a whole bunch of things about their change that made us feel that we really were getting into their ecosystem and changing things in an integrated way. You can see that we changed pain, severity, interference, we reduced anxiety, we reduced depression. We measured something that we think is a really good tool It's about self-awareness. It's a mouthful, the Multidimensional Assessment of Interoceptive Awareness, or the MAIA score. It's developed by a colleague of ours at the Osher Center in San Francisco, Wolf Mailing. And it's a series of questions that ask people, it gives us a sense of how in tune with their body are. So they may ask a question around one of the 8 domains of this is about body awareness. When I'm upset, I take time to explore how my body feels. And after doing this, people endorse that at a much higher level. They're like, oh yeah, this emotional thing, I'm going to look to my body to see if that gives me some insights into understanding it and also managing it. Another one is around trust. I feel like my body is a safe place. And after doing this work, you'll see later with some qualitative information here as well, that people felt that their body was a safer place. So we're changing these very complex constructs that are mind and body at the same time. This is a quote. These women were incredibly articulate, one of many quotes, but one woman said, how you feel about your body is a challenge after you've had breast cancer. But mind and body have to be interconnected. So they know this, especially after doing this training. All of it fits together in Qigong mind-body exercise. Relaxes you, helps you stretch out a little bit, calms you down, helps you think about your body in a different way, and trust your body to get inside yourself in a different way. It doesn't mean you're not going to get cancer again, but it could mean that you're more at peace with your body. I mean, this is, and so we often have an anthropologist or a sociologist in our studies, in addition to getting objective data from surveys and measurements of biological phenomena. We want to hear that first person narrative. And I think that this gives insight into our hypothesis that mind and body are moving together, and they appreciate that. We also do some real fun objective work. This is a diagram. I don't know if it'll work here, but we bring people into the motion analysis laboratory that I partner with. This is Dr. Bonato's group here at Spalding. We can get very objective measures of posture. These are helpful for predicting falls and quality of mobility. But in this case, we were interested in this interrelationship between body shape and affect. And from an embodied cognition framework, this emerging field of cognitive neuroscience, how you think is and feel is embodied in the shapes of your physical body. And so what we were interested in is, how do the body angles in these women change over the course of training, and how is that associated with affective processes? And we were particularly interested in the head and neck. The head folds forward, the shoulders round a little bit, this sense of giving up, of fatigue, but also of shame in changing of body image for these women who've reconfigured their breast area. And what we found was that there was a correlation. Those women who had the biggest changes in this head angle up here, for example, or in the verticality of the upper spine, also had the largest changes in anxiety and depression. Very small study, but there's some growing data out there to support this framework. And the point we want to make here is not that changing your shape changes your mood, or changes your mood changes your shape, but from an ecological or integrated perspective, it's crazy to think of these as separate. And this is where the beauty of these Eastern traditions come in. And while I was doing this, I picked up this very landmark book, one of the first books on meditation to come to the West in a popular way by Suzuki. And the very first sentence of the very first chapter about how to sit says, these forms, these postures of sitting in meditation are not the means of obtaining a right state of mind. To take this posture is itself to have the right state of mind. And I think if you think about the benefits of these yoga postures and many others, you wonder, what's the wisdom in this shape? That the shape encodes a certain way of being. And that's a whole nother lecture that we could present at another time. But it's a big part of the work in my laboratory. And if you don't believe this quantitative data, some of you may be aware of a famous cartoon character, Charlie Brown by Schultz. And I love this cartoon. This is Charlie Brown. He's got that sort of head forward character in the cartoon. This is my depressed stance. When you're depressed, it makes a lot of difference how you stand. the worst thing you could do is straighten up and hold your head high, because then you start to feel better. If you're going to get any joy out of being depressed, you've got to stand like this. Okay? So just to finish up here, I think my emphasis here is to say that Tai Chi is a promising intervention for enhancing balance, mobility, preventing falls, cognitive decline, and pain. The multi-component mind-body training of Tai Chi may afford unique advantages over unimodal therapies, and that balance, cognition, pain are really interdependent, and it really calls for the wisdom and the tools of these more integrative programs in the East, very similar to what Dr. Krishnamurti and his colleagues are doing in his multimodal clinics to deal with mind-body issues. My work is I'm a small part of all the studies that I presented. No time to acknowledge them all, but it really does take a village to do this work. And I want to thank you all for your attention. And again, thank Dr. Krishnamurti for this kind of invitation.
Thank you. Thank you so much. That was such a wonderful tour of how Tai Chi can be very, very helpful in a range of conditions and problems that can affect humankind, and also in preventing them. Before I go to some of the questions that await us, I wanted to ask you, for everyone's benefit, the difference between Tai Chi and Qigong.
Yeah, it's a seemingly simple question. There's a funny joke. You can say yoga, or Tai Chi. How many yoga practitioners does it take to change a light bulb? And the answer would be 100. One to change the light bulb, and the other 99 to say we do it differently in our style. So there's a lot of heterogeneity. But basically, Tai Chi refers to the yin-yang symbol, this dialectic of day and night and change. It's a pervasive concept of the universe. And Chuan translates as fist or boxing or manifestation. So it's moving and being in harmony with these principles of yin and yang, the organic changes in nature. So that Qi is different than Qigong. Qi in Qigong is a character that's very hard to translate. My best attempt at it is that information. It's what shapes things. We know in morphogenesis that fingernails know where to go, and you don't develop kidney cells at the end of your finger in embryology, that there's something that shapes things. And Qi is that information that shapes things. Sometimes it's translated, I think, more limited in terms of energy and vitality, but I think it's more generally this immaterial information that shapes things. And so Qigong is a way of, Gong means skill or mastery, and it's managing and balancing this information in your body. So in that sense, I think Tai Chi is a form of Qigong, but it has very specific origins and applications in terms of martial arts. But there's a full spectrum of practicing Tai Chi and Qigong for health, for spiritual purposes, for practical functional martial arts and things like that. So that's why I feel it's comfortable to pool them together. But I'm sure I would, there are other people that would disagree with that.
Thank you. Alan Alagapan says, great talk. I teach Yang style Tai Chi. What style do you teach? How many minutes a day do you recommend? How many times a day, depending on the condition?
Yeah, it's a great question. And I can just, so I've learned many different styles of Tai Chi. My core one was a form of Yang style. These names Yang are like, they're family lineages, similar to, Vinya flow yoga versus Kundalini yoga versus Iyengar yoga. They're just slight variations. I think there are more similarities across these systems than there are differences. In terms of how long you practice, I practice something daily, and I practice other forms of exercise. I like walking. I do other martial arts that are more vigorous. But I think it's important to do a little bit every day. That's better than being a weekend warrior. But I think the dosing depends on what your situation is. If you're a healthy person and you have an active lifestyle, doing a yoga class or a Tai Chi class 2-3 times a week, or adding a half an hour into your regimen every other day is sufficient. If you have a life-threatening illness, and this is going to be one of your key tools, you need to invest a lot more and have some support of really good teachers and things like that. So I think it's dependent, but the short answer is a little bit every day is way better than not doing any at all, or doing a lot just once in a while.
Thank you. Vivek Mishra asks, as I'm interested in aging and longevity, Moriyama et al. From Fukushima cohort suggests that Tai Chi positively influences longevity. Your comments on the same, is it just Tai Chi or a combination of high omega-3 diet, physical activity, and Tai Chi?
Well, in Japan, these are hard questions to ask. And it's very hard to do a randomized trial for 80 years. Or 40 years or something like that. So these questions are difficult to tackle, but there are some really good epidemiological studies that we can leverage in Asian populations. So for example, there's a big study called the Shanghai Women's and Men's Health Cohort. Ironically, it's based at Vanderbilt University, but the population they're studying is endemic to Shanghai. In the men's study, which has been studied a little bit more for this, there's about 70,000 participants. And at baseline, they queried, tell us about your exercise behavior. And they follow this cohort now for about 30 or 40 years. And they track all-cause mortality. In particular, they're interested in cardiovascular deaths and cancer-related deaths. And what they found is those people, relative to people who are reported being sedentary, those people, about a third, first I'll say a third of the cohort practices Tai Chi or Qigong because it's Shanghai. A third of the cohort do jogging or walking, or ballroom dancing is very popular now, some physical activity, and a third was sedentary. Compared to the sedentary people, there was about a 20% reduction in mortality for the people who did Tai Chi. And that was not different than the people who did jogging or walking. But the people who did both Tai Chi plus jogging and walking had a slightly better outcome in cardiovascular deaths, I believe. I don't want to misquote myself, but there's a good effect there. And in those studies, because they have large samples, they can control for diet, cardio, omega-3 intake, soy, other things like that. And so those effect sizes would be independent of those other things. You have to be careful because these are cross-sectional studies and observational, but nevertheless, it's strong, compelling data that sort of gets at the question.
Thank you. Pavitra Palni wants to know whether prolonged Tai Chi training is required to delay cognitive decline. We all meet people with MCI, and how can we help them best?
Yeah, so most of the studies I've showed you were somewhere between a 12-week, 6-month intervention. And many of the ones that have included, that I didn't share, but there's a growing body of stuff out there, including some of the neuroimaging ones, included patients with MCI. And so they're starting to see some effects. What the long-term benefits of that are, I'm not sure. My hypothesis would be that it only gets better. That as people improve in their skill, that these benefits are going to have longer term effects and that they're going to penetrate. This is a really big problem in this work. This idea of dosing is very different than pharmacological dosing. You can say, I'm going to give 20 milligrams of this to a person with this sort of body mass so that the average dose in the bloodstream is consistent. And they don't even do that. They'll just give the same drugs, but they assume that the uptake is pretty good. But you can have people, as you may know, sitting in a meditation class the same amount of time. And some of them are mind wandering and thinking about their taxes and worrying about their illness. And others are really paying attention and having profound physiological changes, even in a short period of time. So the amount of exposure is not so important as, do people get better at what they're doing? And that we're starting to try to quantify what we call proficiency. We're not interested in just whether they were randomized to Tai Chi or practiced a lot, but did they get better? And we would expect that people who got better with objective measures of balance and mental focus and things like that are the ones that are going to benefit the most. And I think that happens over time. You know, the depth, as many of your practitioners know from doing Eastern practices, you know, you don't just learn meditation and then know it. It is a lifelong, if not many lifelong, learning of it revealing itself and maturing like good wine. So I think I would expect these benefits to continue to improve.
Thank you. Vishnupriya wants to know, thank you for such an informative talk. I would like to know if Tai Chi will be helpful in those who are having a fear of falling with autonomic dysfunction.
That's a great question. I've done a couple of studies I didn't share here, my earliest studies with people with vestibulopathy. And that's an inner ear disorder. Many of them have this because of a tumor on the vestibular nerve that was sectioned. And so they've lost that function, or it was impaired by a viral or drug insult. And losing your inner ear function is really scary. You feel nauseous often, you feel dizzy, you have this great word aslopsia, where things just start to, the floor starts to move, and it's huge impact on quality of life. What we found was in Tai Chi training, we can improve their balance and their fear of falling. But it had two ways that we were affecting things. One was they developed strength and confidence and practical things. And we asked them to shift their attention to other senses, to feel their feet on the ground, to rely more on their proprioception than on their vision and the inner ear. And that allowed them to maintain their balance. But the second piece is that anyone who's had a recent fall or feels like an onset of vestibular instability is going to happen, develops an immediate anxiety reaction. And it's almost as if the anxiety is pouring gasoline on the fire of that instability. And we could decouple that behaviorally by saying, oh, here's one of these waves. I've been through this before. I didn't, die. I didn't even fall, but I know this, and I can have a meta-awareness of this anxiety and step outside of it and pay attention to my breath, to my feet, maybe hold on to something to stabilize me. And so I think that there probably are some links between fear of falling and autonomic disorders through that behavioral mechanism. But I only have personal experience from teaching people with vestibular disorders, and we haven't interrogated that more formally. But I think it's the same with pain-related trauma and trauma in general, that we have to be very careful to make people feel safe in their body and to slowly ask their body to move in a certain way, not to impose something from the outside, but to make it this mind-body spirit collaboration from within. And then I think real change affects much more stably and safely without triggering those other events.
Thank you. I think a very linked question from Aruna Devi. As you mentioned in your talk, Tai Chi helps preventing fear of falling and improves mind-body connections. So does that mean that Tai Chi works on anxiousness, nervousness, and will it be effective on reducing mood symptoms?
Yes, you would think that there'd be really big trials by now on Tai Chi for depression and Tai Chi for anxiety. And there are some. There's some good randomized trials out there, but no huge ones like we saw with the falls data yet. But there's good promise, both for people with general anxiety disorder and major depressive disorder, as well as people who have symptoms of anxiety and depression that are comorbid with many diseases, that Tai Chi can move the dial, as you saw with the breast cancer survivors. So yes, there's compelling data out there to think that this is helpful. I think it's a good complement to behavioral therapy and pharmacological therapy, if not an alternative. And we've done some studies here with people who are already taking medications but are not adequately treated, and this is a good complement to depressive disorders.
Thank you. Dr. L. Mahadevan wants to know, at what frequency does it need to be trained in order to make progress? And is Tai Chi only training as one form enough to acquire Tai Chi Chuan knowledge, or can we add other exercises?
Yeah, I think I've addressed that a little bit. I think it depends on what your goals are in terms of health and wellness. But I would say in our studies, most of the studies out there in the West, I think the East is a little different. In the West, we typically aim to bring people into classes about twice a week for group instruction with feedback. And then we provide materials for home practice, and we ask people to practice at least 3 other days a week. So 4 or 5 days a week of modest levels of training. Home practice, maybe a half an hour, class practice, about an hour. But that's a start. If people are liking this, they can do more. But it's just one tool. Just because you're doing Tai Chi doesn't mean you shouldn't walk. I'm a huge fan of walking, and it's something you can do hopefully and a lot can happen. And what we're learning, actually, we're doing some really nice studies with people with chronic obstructive pulmonary disease and heart failure. They graduate from these cardiac or pulmonary rehab programs being taught to walk and do exercise, and then they do nothing. So they benefit during those couple weeks of training, 6 or 8 weeks, and then they stop. What we're doing is we're taking graduates of these programs and trying to reframe what walking is like. Walking isn't something you check off to tell your doctor, I did my walking or I got my steps in. Walking is your life, and it's a way of giving back to yourself and learning about how you're moving through the environment, and whether you can be where you are or you're distracted. We're teaching them tools of using mindfulness to integrate into everyday activities. And so I would say that as you're learning Tai Chi, it may make your work in the gym or you're walking outside in nature much more enjoyable, because you're bringing your whole self there. And so it's not an either or.
Thank you. 2 questions from an anonymous attendee. One is, do you have a website about your training classes offered in Boston?
I do. I'm happy to share that. If people just type in Tree of Life Tai Chi Center, and it's in Boston, you're very likely to come to me. And we offer classes in person, but also virtually online. We also offer programs to train people to teach the way we teach, because we teach in a very unorthodox way. We teach from an evidence-based scientific perspective, but we also teach from fundamental principles out. We're more concerned about less learning lots of movements, but more learning some very simple phrases of Tai Chi that embody these therapeutic qualities.
Thank you. I'm heartened to hear this, because one challenge I've thrown my team for the forthcoming year is that they need to learn one new skill. So I hope some of them will sign up with you to become trainers.
I'd be honored to share what we're doing.
Thank you. There's a question also about, can you give us the information about the Qigong classes for breast cancer survivors, whether you would have that information. Can we email on that and send it to you?
Excuse me?
Can I take an email on that and then forward it to you so that we pass it on later?
Sure. Yeah, it's a very simple program. We did not make it commercially available, but it's very similar to what we teach in our ongoing classes at the Tree of Life. But I can point them to some things. There's also some online material that I'm happy to make people give access to that we did professionally through the Harvard Health publication. So there's some videos that people can learn at home with.
So people can come through your Tree of Life Tai Chi website, or indeed email us at care@buddhiclinic.com, and we'll forward the request to you.
Okay.
I think the managing trustee of our foundation, Mr. Srinivas Acharya, has summed it up very well. He says, spoken in non-medical, simple language, his knowledge and experience comes out very well. Great talk.
Thank you. That means a lot. I grew up in my parents were Eastern European immigrants, and I was the first person to go to college, and they said go to college so many times that I, like you, stayed in academia for a long time and have embraced it. But my love is translating this to everybody, and we need to take it out of the academic setting and share the wisdom we're learning there, both from research, but also from these traditional practices with other people. And I will therefore take this moment to plug a conference we're doing, 2 conferences, one that's done and one that we're doing. And the one that's coming up is the first Harvard-based Science of Tai Chi and Qigong conference. We have the head of the National Institutes of Health talking, and it's about whole person health and how can these traditional practices inform the evolution of current healthcare. And we have some really nice speakers from the Veterans Administration hospital system that have embraced this whole person health model that I think parallels a lot of what you're doing in your Buddhi clinic programs. The other one I want to point you to especially, but to your guests, is on our website at the Osher Center. The website is oshercenter.org. Last year, we did a transdisciplinary conference on depression. And we had the leading psychiatrists and neuroimaging people talking about what we've learned about the brain, alongside imams, rabbis, priests, Buddhist scholars about the dark night of the soul. We had people who were doing psychedelic research, as well as people teaching yoga and Ayurveda. We had an Ayurveda nutritionist. And for 2 days, we went back and forth on these interdisciplinary panels saying, what can we learn as a whole with this cross-disciplinary dialogue that we don't learn in our more siloed approach to academia? And it was a really successful conference. It's all been archived. It's free access as well as all our grand rounds and forums and conferences on our website. So I think your audience, especially focused on mental illness, will be pleased to see that.
Thank you. Thank you so much. There's one last question. What activities or processes can be done in a hospital setting for a patient more from a mind-body connection?
Yeah, I think that's a great question. I think a little bit depends on the open-mindedness of the hospital system. Some hospital systems here are very limited in access and credentialing. So there are a few things you can do at bedside. Others are more open. Interestingly, here at Harvard, our hospitals allow this team of volunteers to go bedside and do hands-on healing techniques, Reiki, despite the fact that there's not great evidence for this. They allowed literally 20 to 30,000 treatments. No one's documented the benefits of it, but people seem to benefit greatly. Some of our hospitals have integrative clinics where acupuncture can be done bedside. Some are including things like Tai Chi in stroke rehabilitation, just beginning, but none of them are formal yet. So I think this is the next level of integration. Even prophylactically, can you teach people yoga, stress reduction, mindfulness prior to a surgery so that the recovery rate and the tools that they have after that are in place, and they don't have to learn that during this very weakened state of rehabilitation. This peri-rehabilitation is, I think, a really important edge for care.
Thank you so much. That's so valuable to know. Again, another comment, very informative and valuable talk, very accessible to the lay person. Not surprised to hear that, also because I've been seeing how many awards you have got for communication. Peter, it falls upon me to thank you so much for taking time away from your busy schedule to do this today. Thank you for spending your time with us and to all our listeners. I think it's an invaluable contribution to our thinking, which will go up on our website and will be on YouTube for people to listen and follow if they've not been here today.
I want to say thank you for this opportunity. It's a pleasure, it's an honor. And I also want to congratulate you again on all your great successes. And I hope someday soon we can invite you to Harvard to share the model that you're successfully scaling up. I think it'll be an inspiration to our community as well.
Thank you. And I will say namaste.
Same, namaste.